I did PTSD as my disorder. It was discovered in the late 1970s and early 1980s. It was found in soldiers returning from World War I, but was called shell shock. The name was changed in the aftermath of the Vietnam War. What was the original treatment for the disorder? Disciplinary treatment was the most common at the time. The doctors involved with this form of treatment used shaming, physical re-education, and the infliction of pain. Another was electric shock treatment, where an electric current is applied to various body parts. W.H.R. Rivers was a psychiatrist in Craig Lockhart Medical Hospital, and it became one of the few hospitals to practice psychotherapy in the United Kingdom at the time. Many doctors refused to use this form of therapy on shell shock victims, as it sometimes took patients years to recover, and very few returned to war. Symptoms of the Symptoms of PTSD are avoidance of the situation that bring back the trauma, heightened reactivity to stimuli, depressed mood, aggression, irritability, hostility, hypervigilance, self-destructive behavior, social isolation, flashbacks, fear, severe anxiety, uh, mistrust, loss of pleasure or interest in activity, guilt, loneliness, insomnia, nightmares, emotional detachment, and unwanted thoughts. PTSD is not diagnosed unless the symptoms last for at least 1 month and either cause significant distress or interfere with work or home life. In order to be diagnosed with PTSD, a person must have 3 different types of symptoms: re-experiencing symptoms, avoidance and numbing symptoms, and arousal symptoms. Some examples of the 3 different kinds of symptoms that can occur. Depressed mood is an avoidance and numbing symptom. Severe anxiety and flashbacks are re-experiencing symptoms, and hypervigilance, hostility, aggression are examples of arousal symptoms. How do you treat the disorder? You treat PTSD with a mix of cognitive behavioral therapy, antidepressants, or anti-anxiety or sleep aid medications depending on the symptoms, and a support group. Cognitive therapy is to encourage you to remember the traumatic event and to express your feelings about it. This can help desensitize you to the trauma and reduce your symptoms. The support group is a place where you can discuss your feelings with other people who have PTSD. This will help you realize that your symptoms are not unusual and that you are not alone. Antidepressants, anti-anxiety drugs, and sleep aids are to decrease the frequency of intrusive and frightening thoughts and to help you get some rest. Some examples of antidepressants, that is, for PTSD are Straflene or Zoloft and Paroxetine or Paxil. Exercise and diet can help focus the person, but unless they get real help, the disorder will continue to get worse. The character I chose was Marlin from Finding Nemo. His age is approximately 4 years old. His profession is a stay-at-home dad. He's famous for the Walt Disney movie Finding Nemo, where he goes to find his son with his friend Dory, and the recent movie Finding Dory, where he goes to find Dory's parents with Dory and his son. He's not diagnosed. He's a fish. I mean, I wasn't expecting him to be diagnosed. What triggers his disorder? His PTSD is triggered when he leaves the reef he lives in and letting his son be independent. His symptoms are flashbacks, trying to avoid leaving the reef, anxiety over his son leaving the reef. He's neurotic, he's paranoid, and worrisome. What does Marlin do to relieve his anxieties? He goes for walks and plays with his friends, which is Dory. His culture has a lot of open spaces, which Marlin doesn't like. And Marlin is also peer pressured into going into these open spaces, which he doesn't like. Marlin doesn't have potential to get in much injury. If he tries to be brave again, I would advise him to avoid fights. Other than that, there's not much. His disorder puts him in danger. My treatment that I would recommend for him is cognitive behavioral therapy and to see a support group. With his paranoia, it makes it hard for him to communicate and travel far distances. He gets over this somewhat throughout the movie, but it's still crippling.